Welcome back, everyone. I'm Mustache,
And I'm Scott.
and
I'm
together
Hat.
we're Backyard Musings.
Yeah. Science and Technology Channel.
I just felt like calling myself Mustache. Hey, Mustache. So, it is Monday, and this morning we forgot to wish that you had a wonderful Sabbath.
Yeah.
So, we hope you enjoyed your Sabbath. Okay. All
As
right.
always.
Kind of a controversial topic here. Childhood vaccinations in the U.S. are falling fast, and the consequences could be dire. A new study from Stanford researchers predicts that even a small decline in immunization rates could bring back deadly diseases like measles, polio, and rubella, some of which have been virtually eliminated for decades. Their simulation shows that without intervention, we may be on the edge of a new health crisis with hundreds of thousands hospitalized and tens of thousands dead. The study was published April 24th, 2025, in the Journal of the American Medical Association. Would you like to know more?
Okay, I'm old enough to know about polio and measles because I had those vaccines. Did you have those
Well,
vaccines?
I did, and my neighbor, when I was a little tyke, my neighbor, the boy, had polio, and he had like metal braces on his legs.
Yeah, I've known some people that have had that. A member of our ward has that. He's can't use his legs from the hips down. So, but yeah, so this is kind of concerning, right? So, and I've heard a lot of people bring this topic up, and they've talked about maybe it's because of people coming across the border illegally, and I'm not saying just the Hispanic population, anybody coming across the
Could
border.
be flying in from somewhere
Exactly,
that doesn't have.
exactly.
Yeah.
And if we don't know, and they have they're infected, then yeah, this could get out of hand, especially if we don't stay immunized. So, okay, so here we go. Childhood vaccination rates in the United States have been declining, especially since the COVID-19 pandemic began. Um, and I don't know why that is, other than maybe people got soured because of the vaccines then and the boosters and stuff.
Maybe it's
But
sticking it to the man. I'm not going to do what the man tells me to do. That might be it.
but these other immunizations that we're talking about, vaccines, those were proven. I mean, like you
Yeah.
said, some of these things have vanished. I mean, you haven't heard about, well, up until recently, measles and polio for a long time. So as a result, community immunity has weakened, and measles, once nearly eliminated, is reemerging. A recent outbreak in western Texas infected over 620 people, which is that's a sizable amount, led to 64 hospitalizations and tragically claimed the lives of two children. So that is a sad deal.
Yeah. West Texas. We were just talking about that with that national park, with the former reef that's now
Outside
a
of
mountain.
yeah,
Yeah. That's
Carlsbad
West
Cavern
Texas.
and New Mexico, eastern New
Yeah.
Mexico.
Yeah.
Yeah.
If this downward trend in vaccination continues over time, expert warns that not just measles, but other previously eliminated diseases like rubella and polio could return to the U.S. That's the finding of a new study led by researchers from Stanford Medicine and several other institutions.
The study used large-scale epidemiology, epidemiological modeling to simulate how infectious diseases might spread under different vaccination scenarios. Uh, the results are sobering. Even at today's immunization levels, measles could become endemic, regularly circulating within the U.S. within 20 years. That's concerning.
That's
A
his
modest,
concern.
a modest drop in vaccination rates could accelerate this timeline. But the study also shows that small increases in coverage could prevent it entirely. So, and I think they still have it. I mean, if you're going to a public school, your kids have to have some kind of a chart or a record of their immunizations, their vaccinations. So I know I did when I was a kid, and I'm pretty sure that's still the case. And I know some school districts that were doing that for some for free. It wasn't costing anybody anything. Well, it's costing the taxpayer, but it wasn't costing anybody that walked in the door that had it done. So, because again, that's where it's going to spread too, right? Kids,
Yeah,
schools,
kids.
not
The
washing
old,
your
yeah.
hands, just, yeah.
Okay, the research was led by Matthew King. It says SCD. I wonder if that's a science doctorate, a
Hmm.
PhD, but an SCD. Okay, assistant professor of epidemiology and population health, and Nathan Lowe, medical doctor, PhD, assistant professor of infectious diseases. They hope their findings offer clear, data driven insight for policymakers involved in shaping vaccine strategies. Stanford Medicine spoke with King and Lowe about their work. The following interview has been edited for clarity and length, and it's like a back and forth between Nathan and Matthew.
Okay, according to Nathan Lowe, quote, we've seen a worrisome pattern of decreasing routine childhood vaccinations. There was a disruption to healthcare services during the pandemic, but declines preceded this period and have accelerated since then for many reasons. He continues to muse. Continues the quote, people look around and say, we don't see these diseases. Well, that's even scarier when people are in kind of like a denial, right?
Yeah.
Why should we vaccinate against them? There's a general fatigue with vaccines. Okay. There's distrust and disinformation or misinformation about vaccine effectiveness and safety. Um, Again, like I was saying, being born in the 50s and living through into the 60s, that was when these things were. I mean, you remember the little sugar cubes,
Yep.
with drops on them, and then um, getting shots at school. We got
Yep.
lined up and heard it through, and and yeah, we didn't have it, so it was
Yeah.
good.
So Matthew King says, quote, as vaccinations decline, the effect won't be immediate. We wanted to know, when will we see the impact of decisions being debated and made now? Nathan Lowe says, quote, specifically, we wanted to look at some key diseases that have been eliminated from the US through vaccination, which means they're not spreading within the country on an ongoing basis. These include measles, polio, rubella, and diphtheria, which can have awful complications like lifelong paralysis, birth defects, and death.
Yeah. Lowe continues, quote, we used a large-scale epidemiological model to simulate all individuals living in the U.S. and assign them an age, vaccination status, immunity, state of residence, and etc. We then simulated how infections would spread under different vaccine conditions. The model assumes that diseases are introduced by someone who travels abroad and brings them back, most commonly a U.S. citizen who isn't vaccinated. Yet, I don't know about that. But anyway, right now, so many people are immune through vaccination that diseases don't spread far. But if vaccinations decline over a longer period, you start to see outbreaks increase in size and frequency, like in Texas.
Yeah.
Eventually, you see sustained ongoing transmission, meaning these diseases could or become endemic, and they become household names once again. So
I remember when we had an Ebola scare because someone was traveling from an African country back here. Do you remember that? Like a decade ago or maybe 2 decades ago?
yeah, I think it was a couple decades, but yeah,
Yeah.
yeah, there was a flesh-eating disease, right? The people were in the hospital and their flesh was just like falling off, almost like a leprosy type thing. So
Yeah.
yeah, no, I remember that.
So
But
Matthew King explains, quote, for current rates, we took a conservative approach by using average vaccination levels between 2004 and 2023. With measles, we found that we're already on the precipice of disaster. If vaccination rates remain the same, I mean, that's kind of scary. If vaccination rates remain the same, the model predicts that measles may become endemic within about 20 years. That means an estimated 851,300 cases over 25 years, leading to 170,000 hospitalizations and 2,500 deaths. The other diseases are not likely to become endemic under the status quo.
Nathan Lowe says, quote, measles is one of the most infectious diseases that exists. So the number of people who have to be immune to prevent it from spreading is extremely high. Polio, diphtheria, and rubella are still far more infectious than COVID-19, for example, but measles is in a different ballpark. With one person infecting up to 20 others, our model took a conservative estimate at 12 in a fully susceptible population. Also, the MMR, measles, mumps, and rubella, I had mumps when I was a kid, vaccine has become particularly controversial, partly due to a history of fraudulent medical research that raised safety concerns. It has been conclusively shown that there is no link with autism. I'm on either side of that. So, I don't know. Yeah. Measles is also more common around the world, so travelers are more likely to bring it back.
I remember as a child, I had either measles or mumps, one of the two. I remember that.
So
Spots all over my back and chest.
okay, so the mumps was swelling of the jaw.
Okay, it was measles then.
Yeah, spots. Yeah, so and I think our kids had both of our kids had measles. I don't ever remember having measles when I was a kid. So yeah, but that
All right.
was it started from, they caught it at school, I believe. Somebody from school had it. So
Yeah.
but
All right. If vaccination were to fall by even 10% today, measles cases would skyrocket to 11.1 million over the next 25 years. I would think that they would slowly start to spread out and then gain steam, just from the infection all around the United States. If vaccination rates were cut in half, we'd expect 51.2 million cases of measles, 9.9 million cases of rubella, 4.3 million cases of polio, and 200 cases of diphtheria over 25 years. I mean, all this stuff is preventable. This would lead to 10.3 million hospitalizations, 159,000 deaths, plus an estimated 51,000 children with post-measles neurological complications, 10,000 cases of birth defects due to rubella, and 5,400 people paralyzed from polio. This is from their model that they did. Measles would become endemic in less than 5 years. Remember, this is a drop in the vaccinations. And rubella would become endemic in less than 20. Under these conditions, polio became endemic in about half of the simulations in around 20 years.
it's worth emphasizing that there really shouldn't be any cases at this point because these diseases are preventable, like you just said. Anything above 0 is tragic. When you're talking about potentially thousands or millions, that's unfathomable. And it would be they thought that COVID was a strain on our hospital um, industry. This would be crazy
Yeah.
because you'd have to isolate, right? You'd have to
Yeah.
isolate people, and how are you gonna do that? I don't know.
Yeah.
Crazy.
All right, folks. Thanks for joining. If you have comments, I'm expecting a lot of comments from this episode because it's controversial. So send them to us.
And just remember, we're not the experts. We're just reading the information and passing it on. So, but
If you
yeah,
want to interview for a producer position, let us know. All right.
not taking a cut and pay.
Talk to you later.
Take care, everyone.
Bye.
Bye.